Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today we're going to talk about the effectiveness of different kinds of masks. We know that SARS-CoV-2, the virus that causes COVID-19, is transmitted through respiratory droplets and aerosolized particles that are emitted when a person breathes normally, and especially when they cough, sneeze, speak, or sing. But we're still learning about how many particles it takes to infect someone and how long some of these particles stay around in the air while still being capable of transmitting infection. We've all been told to wear face coverings, and I agree with this. But which kind are most effective? Two studies that are very small and simple, but are interesting, provide some data. Both used black boxes, lasers, and cameras to detect respiratory and aerosolized particles. The first study is out of Florida Atlantic University. They used a mannequin to emulate a cough to see how many particles enter the air and how far they travel. Of course, they didn't use humans and they didn't use the SARS-CoV-2 virus, so take that into consideration. They were just doing the best they could with a mannequin. A forceful cough by the mannequin propelled particles about 8 feet without a mask. Then they put different facial coverings on the mannequin, and they found that particles traveled 3.5 feet with a single layer bandana, 8 inches with a cone-style medical mask, and interestingly enough, a stitched homemade mask was most effective with travel of droplets of only 2.5 inches. There was lots of variability, and the summary on the university website did not match the data in the journal article. But the general idea is that face coverings are helpful, and some may be more effective than others. The second study from Duke was published in Science Advances journal. This study used real people speaking the same sentence 10 times. They measured particles without any masks, and then 3 types of face masks were tested 10 times by 4 people. 11 other face masks were tested by only 1 person, and I couldn't tell from the data if it was the same person each time or different people. But let's talk about the 3 masks that were tested by multiple people. The surgical mask performed the best. Next, a homemade cotton mask was second best. Lastly, the bandana seemed to perform least effectively, which makes sense because it's open at the bottom, but it still performed better than nothing. There was a wide range of variability of droplet particle production and distance of travel between the 3 people. One interesting caveat is that the buff or net gaiter seemed to possibly allow particles to travel farther. The hypothesis is that the net gaiter may break up the larger droplets into smaller particles that can travel farther, but they only tested this on 1 person with 1 type of buff. So more data is definitely needed. So at the end of the day, the takeaway from these studies are face coverings are helpful in reducing respiratory droplet transmissions, and different types of face coverings may perform differently. And a homemade 2-ply cotton mask may perform as well or better than cone-style medical masks. As I keep continuing to say in each of my videos, more data and better controlled studies are always needed, and I think those will be forthcoming soon, so stay tuned. Thanks again for joining me.